I'm just going to invite Dr. Cox back. Hi, everyone. It's Dr. Vince Bertucci, and we're just about to get started here. I'm just waiting for Dr. Sue Ellen Cox from Aesthetic Solutions in North Carolina, Chapel Hill, to join us. So we'll just be starting momentarily. Thank you for your patience.
I think I did it. I don't know.
Okay.
So I turned auto lock off.
Okay, great.
If not, I'll just keep hitting it.
Okay. So we're at the hour, and I'd like to welcome everyone. I'm Dr. Vince Bertucci. I'm a dermatologist in Toronto, Canada, and current president-elect of the ASDS. And tonight we're going to be doing the Skin Experts Live series. It's an ASDS series whose mission is to discuss skin health and beauty topics. And these are going to be discussed by dermatologists who are the true skin experts because of their extensive training. And with me this evening is Dr. Sue Ellen Cox, who is president of ASDS. And welcome, Sue Ellen.
Thank you. It's an honor to be here.
Yeah, this is going to be so much fun. I love this. We've worked together so many times, and I'm super excited to chat about fillers this evening and how to improve your skin. So what I thought we'd do is maybe start off with maybe an icebreaker, and maybe you can tell me what's your favorite hobby, and if you weren't a dermatologist, what would you be?
So let's see. My favorite hobbies are yoga, skiing, cooking, spending time with my kids, spending time with my fiance on our boat, just kind of having fun. So those are my hobbies. And if I wasn't a dermatologist, actually, when I was trying to decide in my third year of medical school what to be, what to do, what to specialize in, I was between dermatology and ER medicine, actually, because I liked the fast pace, I liked the procedural aspect, liked having to think on my toes. And so that's basically it in terms of what would you have been?
Oh, geez. So first of all, hobby-wise, just to go over that, I think my hobbies are cycling. I really like to do that in the summer months when we have nicer weather, spring, summer, and fall. And I've been on cycling trips, which has been great. Other things I like to do are photography, which I wish I had more time for, but I really love that. And if I weren't a dermatologist, I think so as a type of doctor, I might have been a procedural doctor. So I might have been actually a plastic surgeon. That's something I've considered. And if I were a non-physician, I might be something to do with design, interior design, architectural design, that kind of stuff. I just like that aesthetic space. So exactly. Yeah, those are some things. That's super interesting, right? We all have all these interesting things. So why don't we get started and talk a little bit about fillers? And maybe first, Sue Ellen, we can ask each other questions back and forth, but sure. Tell me a little bit first, just for the public, that's those people that have joined us, for the beginners, so to speak. Tell me a little bit about what's the difference between fillers and neuromodulators such as Botox or Dysport or Jeuveau and Xeomin.
Sure. So when I talk to my patients about this, because oftentimes patients really don't know, they kind of think everything is either Botox or everything is a filler. You know, neuromodulators, which there are four, as you mentioned, Jeuveau, that are currently FDA approved, Xeomin, Jeuveau, Botox, and Dysport, and I do use them all. And I have done the clinical trials for many of those, as well as several. There's another 3 that are about to be approved over the next few years. But neuromodulators, they basically prevent the contraction of the muscle. So there's a miscommunication between the nerve and the muscle, so you're preventing muscle contraction. So they're really good to help decrease line formation, so you're not ironing in lines over and over repetitively. So those etching lines go away. But how I like to use neuromodulators even more is actually for facial shaping. So if you understand the anatomy of what we're doing in terms of the push pull of muscles, what we call it in medicine the agonist antagonist aspect of them, you can figure out how to lift somebody's brow. You can figure out how to shape somebody's lower face and stop them from grinding their teeth and breaking their back teeth. And you can also cinch up their jawline and give them a better jawline by preventing that, what I call a negative pull or a downward pull of the muscles in the lower face. So I absolutely love using these products, more so for actually giving people a more beautiful shape to their face, even more so than line reduction. But one additional benefit that I often find in my patients is they'll start doing it for several of these issues, and then they'll be surprised when their migraines go away. And they'll be like, oh my goodness, I need to come back to have you treat that area again because my headaches are gone. So yeah, these products are just magical.
Yeah.
And then fillers, and we have a myriad number of fillers, and they all have different properties, and we'll talk about that in a little bit. But I think of those more as instruments for facial shaping. Again, for as we age, we get bony reabsorption and various structures either shrink or get larger, actually, the fat pads. And so we can use fillers in a way to reshape the face and to provide support. So if we're getting reabsorption of our bony structure, we can support the face, and that is where the lifting aspects come in.
Great. So like just to summarize, I would say for those of you out there, the fillers are to fill and to shape and to contour, to restore things that time has taken away or perhaps that we never had from the beginning. And then botulinum toxins or neuromodulators, they're used to relax muscles, and that can be helpful because it can reduce some of the wrinkles caused by muscle activity. And as you said, Sue Ellen, as well, they can be used to shape the face by selectively choosing which muscles we want to address so we can balance the muscles that pull up or pull down and give different shape like the jawline. So I think that's a really good way. And I think we've come a long way, right, from what we used to do when we first started. We would treat the 11s here or the forehead lines or the crow's feet lines, but it's so much more complex than that. And we all know, Sue Ellen, from doing this for so many years, how, that careful assessment of the face and looking at each individual's anatomy and their particular muscle activity and their facial appearance. We've taught courses about this, you and I together, how it's so important to look at each individual and customize their treatment plans. Tell me a little bit about how you go about, if you have a new patient, they come into your office, what's your routine for and they come and they say, I'm not really sure what I need. How do you go about assessing and treating them?
So basically what I typically do is I will hand them a mirror because I always want to find out what their main concern is. I want to make sure that I address that above and beyond everything else. But I also have a Vectra, which is a photography system that allows me to really take a dimensional photograph of their face and then to evaluate it based on a polarized view, which can show reds or browns, or a contour view, which can show sort of grays, or a symmetry view showing two rights and two lefts. And so interestingly, I had a patient today come in and she said, this is her picture, and she said, you can show it during the Instagram. I don't like the way around my eyes look. I feel like they look really tired. Do you think I should do some filler? And I took out her gray view and said, well, there's not that much of a hollow there. It's that, there's really not a space for me to put the filler in. I mean, we can do a little bit in your mid face and re-support that, but what your issues are more fat pads coming forward. So, I have this tool that is really objective and that the patient's looking at themselves and they're like, oh, I never thought of that. I never looked at it that way. So I think that's very, very nice ability. I know that when you assess a patient, you defocus, you kind of stand back and sort of look at them, and that allows you to not sort of focus on specific parts as much, right?
Right. Yeah. So one of the things I like, first of all, I like to ask my patients for permission because oftentimes people will come in and they'll say, I want something specific done. Like they might say, I want my lips done or my cheeks or my chin or whatever. So I asked for permission to make sure that they're okay with me doing a full face assessment. And my rationale is, we don't really want to treat one area without considering the impact of that area on the rest of the face. Because, for example, if someone has a retruded or set back chin that kind of is set back and their cheeks are flat and they say, I want bigger lips, and they already have decent sized lips and you make them bigger, you risk making those lips look like they don't belong with the rest of the face. So I kind of like to look at everything together, correct? I also like to look at facial shape. And we all have different preferences. One of the common preferences for a female is that wants a feminine look is to have an oval type shape. So kind of like comes out where it's widest in the mid face and then becomes more narrow as we go down. So we kind of look and see, are there things we can do, like highlighting, for example, the cheekbones, or perhaps doing a little bit of jawline definition, or if the chin is retruded or set back, bringing it more forward. So looking at the whole picture together. And I think what's really interesting that I've always found is that, people come in, asking for something, whether it's lips or cheeks. And when we do this assessment, which is like a really thorough, time-consuming process, we often find that when we put it all together, maybe it is the thing that they were thinking of, or sometimes it's not. Sometimes it's something totally different. And we do the same thing where we photograph before so that we can show them on themselves, on their own image, what it looks like and why we're suggesting a particular treatment. That's kind of like the art, right? There's the science of understanding the characteristics and properties of the treatments, but also the art of understanding how all the parts fit together. I think that's super important. This is a good time maybe, so Ellen, tell me if someone specifically comes in and says, I'm really concerned because like that patient you just showed about the under eye area, what are the things that you consider when you're assessing that darkness under the eyes? What are some things that, is it always fillers or what are the other things?
It's so often not fillers. Really the under eye is a very complicated area, and I definitely recommend to my patients that they seek a board certified dermatologist or oculoplastic surgeon or general plastic surgeon to really, treat that area, because that area is complicated. And to me, the mid face, which is the cheek area, is the foundation for the rest of the face. So if I'm evaluating the eyes, I'm also going to evaluate the cheeks. Like, are they flat in the mid cheek region and they need some support? And I explain to the patient that as time goes on, what happens is your bony support structure goes from being more of a rectangular shape to more ovalization, and it loses that bottom support. So often putting filler in the cheek will make it so that you don't need to put filler around their eyes. Sometimes you do, but oftentimes just working in the mid face takes care of it. But it's like you said, not always filler. I look at, do they have bags? Okay, those are basically herniated fat pads where the membrane or the septum has weakened with time and the fat pads are kind of falling forward. So I explain that to them and I tell them that, that's often best corrected with a transconjunctival blepharoplasty or some type of a surgical intervention. Yes, we can camouflage it by sort of reducing the shadowing or the trough around it, but we're really not going after the etiology of that problem, why they have those bags. Likewise, sometimes it's just how the eye is fit in the skull, and if it's sort of set back or recessed, it's like looking into a closet, it looks dark, and so that may not be able to be corrected just with fillers. That may be more of a bony structural thing. Sometimes the darkness is due to pigmentation on the skin, and then that's more of a laser issue. Sometimes it's people who have had hay fever, allergies, eczema, those type of things, and they have allergic shiners. So they've got venous, they've got blood vessel congestion there. And so that would be more lasers. And sometimes it's just crepey skin. They have lots of lines. And lasers are the go-to for resurfacing, that region. So eyes, complicated, need thorough evaluation. There's lots of different things that can be done for them. Sometimes they're complementary treatments, not just one specific treatment that you can do to attain the results that you would like to see.
Yeah, I think so. To summarize it, you said it really beautifully. You covered all the bases. I think that, we need, everything is dependent on that assessment. I mean, lots of people know how to inject, but that assessment, that thorough understanding of what's underlying there, the anatomy, is it a pigment problem? Is it a fat pad problem that's overly projected and sticking out? Is it a hollowing problem? Is it a cheek support problem? All these different things, and knowing what to treat first, that's the magic. The magic is in the whole, how you make this symphony come together. You got all these different parts, and how do we make them come together to give amazing results? And because I don't know about you, but one of the things I'm seeing more and more lately is I'm getting patients coming in for the first time, and they're like, "Ooh, I went and got this done, and I really regret it because now there's something off, and I don't know what it is." And specifically in the under eye area, one of the more common things that I'm seeing is that they get bulging or kind of a faint blue-gray discoloration. And so typically that's the most common area, I would say, on the face where you can inject too much filler and it can look bulgy more so than the cheeks. And it's not supposed to look like that. The cheeks are supposed to project more than the under eye area. So then what we have to do is, again, after explaining things, saying, hey, we need to start with a bit of a clean slate here. We need to dissolve that under eye filler and get the balance and proportions right by addressing the cheeks and then being more judicious with smaller volumes in the under eye area and not making them bulge to make them look natural, because ultimately that's what we all want. At least that's what I want. I want to look like the refreshed version of myself, not like I've been, treated. I want people to look at me and not know why I look good. And that's what I want for my patients. I want them to look great without looking done. Yeah.
I call those the pillows under people's eyes. It's
Yeah.
just that and sometimes it's actually the person chose the wrong filler. If a specific filler is chosen that likes to suck water in or absorb the water, then over time, even if they look good, maybe the first few months that they've had it done, over time, it just starts looking worse and worse. And, that is a common problem. So I agree with you completely. To me, around the eyes, less is more. I tell my patients, if I can get a 50 to 70% improvement, it's a home run. We're not going for the 100% in that location on the face.
Yeah, and we know that that area often ends up looking fuller, after a few weeks or a month. So it's better to undertreat, like you said, and then add in more if you need to. It's never too late. It's just you don't want to have to undo what you've done. And maybe this is a good time for us to talk about the thought process that you go through, and I can talk about my thought process, and I think we think very similarly in this aspect respect, is the thought process of choosing particular products. What are some of the things that you consider when you're choosing a filler for an area or a patient in general?
So I think the first thing that I think about when I'm choosing filler is I'm thinking about the person's face in front of me. That's the most important thing. Do they have, fine, delicate skin? Do they have a lot of sagging of their face? What's their underlying bone structure? Do they need more projection or lift? And if they have a very round face, it sounds like a contraindication, but for round faces, we can slenderize them, make them look not as heavy by building up the cheekbones laterally in the back here, so we can get some lift. But for me to achieve that, I need to make sure I choose the right product. And that product has to be a stiffer product that can actually provide some lift in a patient with, heavy, more oily skin, more sagging. So, it's imperative to look at the person in front of you when choosing the filler that you want to use, even in the same location. So I don't have one specific filler that I use in the cheeks. For somebody who's got more delicate bone structure, thinner skin, there are other fillers that I'm going to choose that aren't as thick or as robust, that are going to conform around the bone a little bit more and be more delicate in that delicate face.
Yeah.
And likewise, if I'm treating lines or etched lines around the lips, I'm going to be using a completely different filler. I'm going to be using one that's thinner, more, watery almost, so that I don't get lumps or bumps, and it integrates really nicely and looks very natural and is very flexible and achieves that particular filling. So I'm not speaking specifically about name brands of filler right now. I'm just kind of speaking about their properties.
Yeah, and I think you just to summarize, I think you've covered all the important topics. We want to look at the individual characteristics of the area of the face that we're treating. Thick skin, thicker skin, mobile skin, fixed skin. Do we need lots of lift or just kind of like soft volume? Do we need the product to be able to be mobile and move with the skin, such as around the mouth or around the eyes, or do we want it to be stiffer? And then what is the ultimate goal that we're trying to achieve? Is it contouring where you need almost like bone-like structure, such as on the jawline or for cheekbones? Or do you need very delicate, fine products like on the lips or the under eye area? And then you mentioned something else important about that I think is super important, just to reiterate it, that when we're looking at these characteristics of these properties, or of these fillers, I should say, we want to know how much water, for example, do they attract to them. So in the under eye area, we don't want to pick a product that attracts a lot of water to it, because we don't want to get that puffiness, that pillow eye, as you called it, the bloated under eye look or the bluish gray color, all these sorts of things. I think they're super important. And I think maybe we can make a little point here about the importance of research, right? Because a lot of the stuff that we do is based on clinical research that's been done. And I know that the two of us both participate in clinical research. We've done dozens of trials over the years, trials that have led to the approvals of many of the products that we now use. Maybe you can comment a little bit about that, and then I'll continue a little bit later, Sue Ellen, after you do.
So, I mean, I love doing clinical trials. That's a big part of my practice. And I think that my love for it is really getting to be able to use these products before anybody else, so I can figure out where they work best. Yeah. And we're using them in a really controlled way when we're doing it in a clinical trial. And then we're able to freelance a little bit more when we're using it on our patients. And so we can really customize and adapt the product to treating that patient. And we've already had a year of experience before it's even approved to be used. So it really is a true benefit. And we can see what it can do and what it can't do. And then again, jumping off to the real world, how it could then be best used for the patients in front of us. So that's my favorite aspect of clinical trials, because honestly, they're not easy to do. They take a lot of work. They take somebody who's, very, very dedicated and, precise. And you have to I now have 3 clinical coordinators. I started with 1, and I currently have over 10 studies that I'm doing. So it's a lot of work, but there's a big reward at the end of that. So you don't do clinical trials for money, though. I've got to say that. That's not the reason to do them. The reason is because it's exciting and you love to be on the cutting edge, and then you love to be able to tell the companies what products you need. What are some things that we want in our armamentarium that we might not have right now. So, and I know that you have one of those, which is skin boosting, which we don't have.
Yeah, so I totally agree. The clinical trial thing to me is exciting because I love to get things ahead of time, figure them out, help industry companies in teaching other physicians and other individuals on how to use these products so that they can get the best possible results. And I think it's really great to have a head start. So by the time it's available, you've already figured all that stuff out and you know exactly all the details. You've had a chance to understand all the characteristics and qualities and give feedback. I think another thing that I want to point out is I think that, when you're trying to choose a physician, I think, how do you pick the person that's going to do your injecting? And I personally think you need to know what the education is of that person. What's the experience of that individual? And one of the reasons as dermatologists, we end up doing a lot of these clinical trials that end up leading to the products being approved. And so many of the innovations have come from dermatologists. So for example, Kybella or Belkyra here in Canada, the injection for under chin fat dissolving, various different fillers, the neuromodulators like Botox, like Dysport, like Jeuveau, like Xeomin, and the new ones that are coming out. We were involved in all those trials. and I think dermatologists have a lot of training. So that's a little plug for us.
Yeah,
Um,
we were the
I think,
pioneers.
yeah, I think in so many things, so many of the lasers that are in use now were developed by dermatologists. I think one of the biggest places is, in Boston at Mass General with the laser center there with Rox Anderson and our colleagues that have been instrumental in so many things. The fat freezing devices, I mean, amazing technologies, just a great, great stuff. You were talking about something new that's coming to the US and we've had now for several years, which is the so-called skin booster treatments. And so skin boosters, the whole concept is that fillers are not just for actually creating contour and volume and filling, but rather they can be used to actually give better skin quality, hydrated skin that looks healthier, supple and soft and hydrated, so and not dry and dull. And so in Canada we have a number of them, and I know that in the US you're going to be getting some of them. So we have, for example, Restylane skin boosters. We have the TLCL line. I know in the US you're going to be getting RHA1. We also have Juvederm Volite, which I understand is close to being approved, or probably going to be approved in the not too distant future in the US. And so there's a lot of different problems. There's also Bellatero. They have some products here in Canada as well for that purpose. What do you think, Swell? I think you've been involved in some of those trials as well. Let's talk a little bit about that.
So I'm very excited for them to come because we don't have them, and I'm actually about to start a couple trials for neck and décolleté area for skin boosting, but I haven't done any of the facial ones trials, but I have created my own poor man's skin boosting after going to an ad board where they were using the Restylane Vital or Restylane Silk in this country, and they were placing it with cannula for those curved lines and that crepey skin on the cheeks. And so I started doing that, and I was getting, phenomenal results, but it's not the typical skin boosting that you would kind of place with fine needles or, sort of into the skin like you guys are currently doing. But it worked. So, I've been pleased with it.
And there are different ways of doing those injections. So the classical way is what you just described, with a whole bunch of little, very superfine needles injecting extremely superficially. And it gives this nice, like I was saying, boost to the appearance of the skin, making it look healthy and hydrated. And that's probably the more common way to do it. And typical areas are, as you pointed out, the cheeks, the chin. Those are the most common areas, but can also be used in the neck, the décolleté on the chest. Those would be the other areas. The second way that some people do it, and Suella and I sometimes do them like you just described, would be using a cannula, which is a long, thin, needle-like device that's blunt at the tip, and you can thread it under the skin, kind of creating like little paths or tunnels superficially, so that it helps to, again, give you some of that improvement. It's good for those little accordion lines, so to speak, that when we smile, or they get that etched in there. It can be used under the eyes in the same way. So there's lots of uses, and it's where you don't really want filling, but you just want to improve skin quality. So that's something exciting that's not too far from getting approved in the US, and we've got a bunch of those here in Canada.
So is it mostly younger patients that are doing this in your office, or really everybody? Because it seems like it would be a good entryway point for younger patients who just want to have healthier, doughier, more, luminescent or brighter skin quality.
I think a couple of things. So I think that the younger patients who often don't need fillers, like to fill, so to speak, because they're already young. They don't need to be made to look younger. They already are young. But everyone wants that boost to the appearance of their skin so that they look doughy, healthy. So yes, definitely for those younger individuals, but also the other individuals that are in their 40s, 50s, or beyond, who already have had filler, but they want to improve the actual surface skin quality. That's another group that I think would benefit from it as well. So I don't think it's age specific. It's just used in a different way and maybe in a different order, so that, typically for me, for someone that's a little bit, like maybe in their 40s or 50s or beyond, I might do regular fillers first and then sort of add to it as an adjunctive treatment, the skin boosters. Whereas in the youth, more young individuals, then we might go straight to that, like you pointed out. So I think that's pretty correct. That's how I would do that. Yeah.
I'm excited for us.
Yeah. I think
we just are getting the RHA1. I think it was just approved, so I haven't yet used that.
Amazing, amazing. So another topic to talk about, some of the more popular things that I think people are talking about are coming in asking. There's a lot of, social media has like been so huge in shaping people's opinions and what their go-to treatments end up being. And some of the more popular things that I see are lips and jaw lines and chins. Why don't we talk a little bit about that? Tell me a little bit about lips. We'll start with that. Tell me a little bit about lips from your perspective, and I'll chime in after, and then we can talk about chin and jawline.
Sure. Well, lips are sort of a big category because everybody's lips are different. And I really don't like it when somebody comes in and brings a picture of somebody else's lips and says, I want my lips like that person's lips. It's like coming into your hair cutter or your hairstylist and saying, I want this person's hair when your hair is like completely different. You just can't do that. So I think that, I like to educate my patients that I'm going to be working with their innate anatomy. It's like, what was their God-given lips? So we're not going to be changing them. We're just going to be enhancing them. And that is different in different people. So enhancing somebody who may be in their 70s or 80s means that I need to do what I call perioral reconstruction, meaning I need to not just work on their lips, but I need to work on all the structures around that area to support the lip. Because if I just put filler in the lip and they don't have the integrity of the soft tissue above the lip, it's going to just look kind of avert and look funny and look duck-like, or, so you don't want, so you really need to be able to, what one of my colleagues calls starch the upper lip, so to speak, so that you give them a little bit of support and you work on the etched lines, and then you can sort of outline their, the border of their lip and give them a really beautiful lip. But it's not just the lip in isolation. Whereas somebody in their 20s, they might want a little bit of sexiness to their lips, or a little bit of just a, shaping to their lips, or structure to their lips. And then I'm going to use a completely different filler, one that is going to give them a little bit more volume and a little bit more shape and structure. And I'm going to inject them differently. But I'm still working within the integrity of that person's own anatomy and own lips. And it's interesting because people who have fuller lips, it's easier to fill their lips because they can hold the product and it can look really natural and beautiful. It's interesting, we were just talking about clinical trials. I did several clinical trials for lip fillers, including one called Restylane Kiss and one called Restylane Silk and Juvederm. But, those filler trials require that we have like a 2-grade improvement and that's kind of ridiculous to me, because people don't want their lips, somebody to be able to see that their lips are 2 grades, bigger than they were when they started. So in some ways, back to those trials, they can be a little bit slanted in an unnatural way. And so, but it is, kind of pushes the limit on things.
Yeah, I think so a couple of key points to summarize, I would say, because I think we think alike in this respect, and that is, look, the lips do not exist in isolation. They belong to the rest of the face. So we want to make sure that everything that we're doing is proportionate and harmonious and balanced, so that you don't want to put Angelina Jolie lips, for example, who's got very large lips vertically and horizontally. You don't want to put those lips on someone with a very small, narrow face. They look disproportionate. Similarly, you want to look at their chin, their nose, their cheeks. Do they blend? Do you want to look at the surrounding structures, as you pointed out? Because those are important. You can't just put duck lips that are just really, really disproportionate and large without having the foundation and the structure around it. So I think that's super important. Look at the big picture. And you're right, you can't necessarily replicate someone else's lips because our anatomy is different. So I think that's super important. And then another thing, which we kind of talked about a little bit earlier, is marrying the product choice to the goals. So for example, if someone already has decent sized lips and they want a little bit of hydration to give them that gloss of almost like they have lipstick on without actually putting on lipstick, that type of individual might benefit from a thinner, more superficial product. Whereas someone that needs structure or architecture, where they want more of the pink to show and the lips need to be turned out, then you're going to need a product that's a little bit stiffer that will give that support, that architectural support. So those are all the things that we're kind of thinking about as we're treating. let's talk a little bit now about chins and jawlines. First of all, let's talk about what are some of the differences between men and, or sorry, I shouldn't say men and women, feminine versus masculine chins and jawlines.
Well, I
I was
think that,
actually just, yeah, go ahead.
you know, with regard to that, again, you have to kind of look at the entire face. So when I look at the jawline of a female, I'm always going to look also at their cheek, because again, we want their cheeks to be more projected and more angled than their jawline. You want it to slim in. And so you really don't want to create a heavy jawline or, you know, lower face in a female, particularly as they get older, because they're already at a disadvantage with their fat pads, which are kind of coming down and sagging.
Yeah,
So, but there
definitely.
are ways, that techniques that we use that can actually benefit older patients without giving them that heaviness, like putting it behind the bone, way back here in an area where it can actually support it, kind of tuck back that skin, as opposed to make the jawline actually bigger. And men, they love to have more of a stronger jawline, and sort of dropping their cheek down, it should be, you know, flat. And you drop you know, a line down, a vertical line down, and it's not going to be angled in like it would be with a female. So a strong jawline and a strong square chin is going to be more masculine, and for a female, more projection in the cheeks, angled downward, and a smaller, sort of rounder chin, not so square and heavy, is going to be more the aesthetic that most people desire.
Yeah, so I think again, just I totally agree. I think that we want to make sure that what we're doing is that we're looking at the patient as a whole, looking at the sum of the parts. If someone has, you know, very flat cheeks, you don't want to give them a wide cheekbone because that kind of distorts the proportions from what they should be. Ideally, it should be straight on the side profile view in a man, whereas in a woman, it's going to be a little bit more like this. And then the other thing that I think is super important is asking individuals what they're looking for, because, you know, they're the traditional sort of canon, so to speak, of what a male versus female shape should be. But we know that not everyone likes traditional. And so I always ask my patients, are you looking for more? I tell them what the standard, so to speak, is, whatever that standard is. It varies, of course, with time and social influence. And then I ask them, what are they looking for? Is it more like a well-defined for a woman like Angelina Jolie, where it's very architectural, very square, or do they want a more rounded, you know, jawline? Do they want a softer chin, or one that's more projected? And, you know, we know that in certain, like in the profile view, we want roughly, if you draw a line straight down from where the pink meets the white of the lower lip, if you draw a line straight down and look in the profile, it should be roughly in line. So there are all these measurements that I guess, you know, you and I do sort of very intuitively, very simply, because we've been doing this for a long time and have studied all this stuff. Those are all the important things to consider, or some of the important things, not all of them. And they're important in giving really nice results, again, because you want to be able to do things so that people look like the best refreshed version of themselves, but not where they walk in a room and the chin walks in before they do, or the lips walk in before they do. You know, we want them to look great without looking done. At least that's, again, what I'm aiming for.
I agree completely. And I think that a lot of times when companies sort of get a product approved, then they go on this teaching spree of, you know, how to do cheeks or how to do chins. And then all these people are coming in, you know, with a specific area of their face that has been treated, and without looking at the whole, like you were saying. And then, like you also mentioned, ethnicity is important. You know, so a lot of times we'll see somebody who might be Asian and have a wider lower face and stronger muscle here, muscles. And we don't need to even use filler. We can use the neuromodulator to shrink that down if that is a desired aesthetic for them.
Yeah, A couple of other things, because some of the questions my patients ask me are, number one, not number one, but let's say I do filler and then I decide I don't want to do it. What's going to happen? Am I going to look normal after? Am I going to look worse? Is it going to stretch my skin? And my answer to that is, first of all, we're not putting in so much filler that we're stretching anything. We don't want to do that, because if we've done that, it means we've put in too much.
Exactly.
So it will go back to the way it was, I tell them. If anything, there is some data that the hyaluronic acid type fillers and even things like Sculptra and the polylactic acid Sculptra and Radiesse or calcium hydroxyapatite, they stimulate new collagen production. So by doing that, they actually help to give better skin quality and thickness. So, and we know that we have enzymes that break these things down. They're kind of just little molecules that, like sugar molecules, so just that are joined together. And then what ends up happening is that they get broken up and they go away, because we know that these products are very similar in composition to what we already have in our skin, which is hyaluronic acid, for example. Yeah. Did you have anything you wanted to add to
Well,
that?
it brings up a really good point, which is, you know, how long do these products last? And in different areas, when patients ask me, well, how long is a product going to last? I often say, that's a really great question. And we have our answers based on what our clinical trials have shown. But those answers really scientifically aren't always correct, because it depends on the level that the product was placed. Is it placed against the bone? Is it in a stationary area? Is it placed around a mobile area, like where you're eating and chewing and talking and there's a lot of activity going on, and that may break the product down? Is the product more cross-linked? Is it going to stick around longer? Is it a softer product? There's so many different things to think about, and some of that information really isn't, you know, we don't have good studies to really identify what the right answer is.
Yeah.
So I sometimes can't tell my patient how long the product's going to last in that particular phase. And sometimes there's patient factors as well. Are they a marathon runner, for instance?
Exactly.
You
Yeah.
know,
It's really interesting, because when you look at some of the trials for these products, they say 18 months duration for some of the hyaluronic acids, but they don't really say, well, yeah, but that was with a touch up, because 18 months would be uncommon. You might see that if you treat the under eye area in some individuals, but in other parts of the face with one treatment, I find that that's unusual. I don't know what do you agree with that?
I completely agree. And just the area that you brought up under the eyes, you know, I've seen patients, you know, many years ago, before people were really injecting around the eyes, I had this woman come in and she's like, you know, I've been to an endocrinologist because I have just this puffiness under my eyes. I don't know, you know, why I have it. And, you know, I said, well, have you ever had filler under your eyes? And she said, oh, no, it's long gone. It was over 5 years ago. It was when I lived in California. And I said, you know, humor me. Let me put a little bit of this enzyme underneath there and see if I can get rid of it for you. And in fact, it did. So, you know, and it was placed at least 5 years previous. So that tells me that we really don't have a scientific knowledge to be able to say in any specific location on any individual's face how long that is going to stay.
Yeah, that's a really good point. I have this one patient, it's really interesting. I treated her literally over 10 years ago in the under eye area, and she comes back periodically. She says, it must be time now. It's been so long. She doesn't actually need anymore. And that's granted, it's extremely uncommon, but I always tell my patients, it's not a fixed amount of time. We look and assess each individual time, and we'll make the decision together based on what it looks like in that moment, because the reality is that everyone is different. So I think that's super important point that you brought up, is that it's not a cookie cutter answer. It varies from person to person. And that's the importance of doing the assessment every time, and not just saying, yep, it's 6 months, we're doing lips, or it's 3 months, we're doing that, or 9 months, we're doing this. It's really look at the face each time. And so when I look at my schedule, the most common thing that it says under the reason for the visit for fillers, it says, whatever Dr. Bertucci thinks. And it's kind of funny because, you know, we end up doing all parts of the face from the forehead down to the neck and so on. And it really, every time it's different depending on what we see as the need after having a conversation together and coming to an agreement as to what to do.
And
Yeah.
that brings up a good point, because when I have a patient come in for a consultation, what I like to do is go very gradual. So I tell them that really when I'm doing fillers, it's a series of about 3 sessions, because each time I'm going to refine it a little bit. And I usually start in the mid face, but as I correct that, then sometimes I see that I need to work on the temples, or, you know, or another area comes to mind. And that way, and they have the opportunity at any point along this timeline to say, I'm happy at 2 sessions, or I'm happy at 1 session. But it also allows me not to ever over treat patients, or not to use too many syringes at one time. So my average for somebody who I've never treated before would be, depending on their age, would be between 3 and 4 syringes for a
So
full.
that what you just said made me think of something else, and that is that we talked earlier about people coming in and asking for a specific thing, whether it's the lips or the cheeks or whatever it might be. And oftentimes we'll find, especially as age, with age, we find that perhaps they need more than one area treated. And one of the things that I like to do that I find is helpful is having done this thousands of times and knowing what each area the outcome is going to be, is trying to give them kind of like a priority list of number 1, 2, 3 of the things that I think are going to make the most difference. And that's the importance of having an expert such as a board certified dermatologist that does this all regularly so that they can actually prioritize things for you and let you know what will be most impactful. Because some people, I don't know if you see this, I frequently get older women coming in and say, oh, I want those lines around my lips. And, I say to them that, yes, I can see the lines, they're there, but perhaps they have something that's going to be much more impactful, such as, for example, the cheeks or the under eye area. Because I find that certain areas, certain corrections or certain issues translate into how the face is perceived. So, for example, someone looks tired, typically that has to do with the under eye area and the cheeks. If they look sad, I find that it relates to hollowing in this area and sagging in here. If they look saggy, it's often because of the jowls. If they look stern and angry, it's because of the 11s between the brows. So one of the questions I ask them at the beginning is, when you look in the mirror, how would you describe yourself? Are you happy or sad, angry or serene, rested or tired? And those things translate into certain areas, and it allows me to message or explain the message as to why we might want to treat a particular area to address their concern, as opposed to saying, I want my lips done or I want my cheeks done or whatever.
And that's interesting, because today a patient of mine was like, people always think I'm angry. My husband keeps asking me why I'm so pissed, why I'm so mad at him. So I just had to say, well, your face isn't projecting how you feel inside because you have some deep furrows here. So I said, let's just, soften that. That'll soften that quote unquote stern appearance. And I think that people will relate to you differently, and your face is then going to reflect how you feel inside more. And she was like, oh, I never even thought of that. That's brilliant. I'm like, no, that's, that's what makes you feel really good.
Yeah, and I think these are all like little points, little tips that I think for any doctors that are on the line in terms of how to assess their patients, but also for our patients to go in and tell the person that you're seeing what it is that you see overall when you look in the mirror, as opposed to, I want this line or that line done. Because being open-minded, I think I always say, ask open-ended questions, because if you ask open-ended questions, like, what do you think? And, avail yourself of the expertise that's in the room with you so you can get the best possible results.
And also don't forget about skin quality. I mean, that's a huge thing. I mean, skin quality, you can do all the filling and the relaxing of muscles and, but if you're not addressing sun damage and skin quality, then it never looks as beautiful. So, beautiful skin is a great starting point. So I always talk to my patients about the options there, whether they're lasers or microneedling or, even other types of energy-based devices that produce a little bit of tissue contraction. So, and we're lucky because we have this beautiful area of things that we can do non-invasively without much downtime, if any downtime. So patients can, walk away feeling really good about themselves and, just approaching the world with a really happy viewpoint.
Yeah. Yeah, I think that's such a good point. Tonight we've covered mostly talking about fillers, but fillers are just one part of, like you said, the armamentarium. And I think, how you said at the beginning, how I stand back and defocus. The other thing I do is when I walk in a room, how if you walk in a room and you see someone and you're 6 feet or 8 feet away, even before you approach the person, you've already formed an opinion of them. And we know literally from data, from scientific studies that have been done, that in less than 1 second, human beings form an opinion about the other person. It actually has to do with, species survival and finding a reproductive mate. It sounds kind of outlandish, but it's actually true. At the end of the day, it's about species survival and survival of the fittest and so on. So we want to listen to what our brain intuitively knows and notice what the things are that are actually most apparent, what I call the most distracting things. So like you said, Sir Ellen, in some individuals, if they have very blotchy or very wrinkly skin, you might want to address that first. If someone has a huge amount of sagging but very good quality skin, you might want to address that. If someone has just more tension in their face because of muscle activity, like what you talked about up here, you might want to address that with neuromodulators. So like you said, we have so many great tools in our toolbox now, and making yourself avail yourself of all those things is amazing. And going to someone that can actually work the magic, putting all those things together and choosing the right combo that's going to give you the most impactful results. Because the reality is very few people have endless budgets. So then it's a question of how do we use our dollars wisely? And I don't know about you, I think we actually are the same this way. Patients will often ask for something and I say, no, that's not actually something that we should do, because either it's not going to be impactful or it may make your overall look worse. So those are things. So it's like, you know, it's not just what you spend, it's also what you don't spend in an office. Right. Yeah.
And we'll put a plug in for what you just mentioned, which was Nancy Etkoff's book, Survival of the Prettiest, which is an excellent one for everybody to read, because it really does talk about the psychology of appearance and how that informs other people's interactions with you.
Mm-hmm, mm-hmm. We've covered a lot of material tonight, and I've loved being on this Instagram Live with you. I think you said this was your first Instagram Live, right?
Yeah.
You did amazingly, and I haven't done that many. I think I've done maybe 2 or 3 in total. So this has been so much fun. I think one of the things that maybe our audience might want to know is how they find a dermatologist, an ASDS board certified dermatologist. Well, they can go to on the website asds.net/find. That's asds.net/find, and you can do a search for a dermatologist in your area. And I'd like to welcome everyone back for this Skin Experts Live series. There's a whole bunch of these coming up in the future, and you'll be notified on the ASDS Skin MD Instagram page. So please do join us. And this session has been recorded and will be available for repeat viewing on the ASDS Skin MD, and probably on your Instagram as well, Aesthetic Solutions NC, and mine, which is Bertucci Derm. So did you have any final words, Sue Ellen?
No, I love being with you, Vince. This was amazing. It was so much fun. And I entertain people to send us questions if you have any. And let's do it again.
Love to. Well, thank you everyone for participating. It was great, and we look forward to the next one. I've been watching for questions, and I think we've covered the things that our audience is listening to.
Perfect.
Thank you very much.
Here.
Thank you to everyone. Have a great evening. Take care.
Good night.